Hi, my name is Kristen Gaither, and I'm presenting my formal report on integrating holistic practices to treat residents in long-term care with anxiety. My feasibility determinations examine case studies of previous holistic practices performed. I theorize my own study in a long-term care facility and interview nurses in different settings for their outlook. You might ask, what is holistic nursing? Holistic nursing is treating the mind, body, and soul of a patient rather than just their disorder. Holistic practices include presence, soothing music, meditation, yoga, pranayama, which are breathing exercises, or comfort measures such as a warm blanket, an ice pack, or an extra pillow. Why holistic practices over traditional medication? Holistic practices are natural and have little or no side effects compared to most traditional medications. Benzodiazepine usage leads to dependency to any patient, and in the elderly, this medication can have detrimental effects when used long-term. Side effects include hypertension, cardiac arrhythmias, slow heart rate, apnea, respiratory depression, nausea, vomiting, blurred or double vision. My research materials include research conducted by testing holistic practices in a long-term care facility to residents with anxiety disorders. I tested holistic practices such as hand massages, yoga poses, guided meditation, breathing exercises, and soothing music. Other research includes an article studying an alternative therapy to residents in a nursing home by playing gospel music to them. I also interviewed Karen Pritchard, intern director and nursing instructor at Western Piedmont Community College, and Victoria Lingle, director of nursing at Autumn Care of Drexel. My case study at Autumn Care of Drexel showed me that the holistic practices I performed to residents, they reported feeling less anxious and calm afterwards. The results are as followed. Resident 1 accepted the breathing exercises, pranayama, and the alternative yoga poses were seated. They performed mountain pose and half moon pose. They showed some pain during half moon pose. The hand massage was also accepted, and they felt relaxed afterwards. They tolerated the meditation with soothing music for a few minutes. Resident 2 accepted the breathing exercises, pranayama, and alternative yoga poses were provided, such as a shoulder roll, but that caused too much pain because the resident had some shoulder pain. We tried neck tilts from side to side, which were tolerated, and a chin to chest move, which was also tolerated. They accepted the hand massage and experienced some pain. This resident tolerated the full duration of meditation with the soothing music. Resident 3 accepted the breathing exercises, and the yoga poses performed were mountain pose. They experienced no pain, and this resident was able to stand and perform all of these yoga poses. They also did half moon pose with no pain. Resident 3 accepted the hand massage and overall felt a sense of serenity after the hand massage was done. They tolerated the soothing music for a few minutes with the meditation. Resident 4 accepted the pranayama breathing exercises with some difficulty at first, but after guided breathing, I was able to help this resident with breathing exercises. Alternative yoga poses were provided, such as a seating cat-cow pose. They experienced no pain, and a seated half moon pose with no pain, and mountain pose seated with no pain. They accepted the hand massage and overall felt calm afterwards. They also accepted the meditation for about a minute with the soothing music. My interview with Karen Pritchard showed me that she had extensive knowledge on holistic nursing and used holistic approaches in her own practice. Pritchard stated that it would be better to offer things such as a warm blanket, your own presence, an ice pack, or an extra pillow before asking the doctor to prescribe a medication. My interview with Victoria Lingle showed me that she was on the opposite side of the spectrum on her knowledge of holistic nursing. However, after an explanation of what holistic nursing was and what I expected from this case study, she understood of what I was expected, and she told me that we do perform some holistic approaches in the nursing home. And she also agreed that these holistic approaches would be better than traditional medications. Lingle did, however, bring up some good points. It would most likely be more popular in larger cities in regards to holistic nursing to start reforming. It would also be more likely and take more time for all facilities to change their policies. In the gospel case study, nursing students played gospel music to residents in the nursing home as an alternative therapy. Evidence showed that residents had more cognitive abilities, it reduced anxiety, and lowered blood pressure and pulse. It also relieved stiffness and improved coordination in patients. Based on this evidence, in their case study, my own research, and online resources and articles, I found that integrating these studies would be a good decision. However, there are still some negative aspects. Healthcare policy reform. It would take time and effort to reform all healthcare policies. There would be a pharmaceutical decline. Pharmaceutical companies would lose a lot of business from healthcare facilities. Also, there would be withdrawal symptoms. Residents would experience withdrawal symptoms from benzodiazepines. And on the last slide, I have all of my citations and references. Thank you for your time.